Okie doke, so this is our final talk on hypersensitivity reactions. Just to remind you, we've already looked at types 1 to 3, and in this video we'll be looking at the type 4 hypersensitivity reaction. And we've got a 54-year-old male who presents with increasing shortness of breath for 6 months. X-ray shows multiple enlarged hilar lymph nodes with reticulonodular opacities, and his biopsy 2 weeks prior revealed non-caseating granulomata in the lung parenchyma. Again, stop the video, see if you can figure out what this is, and try to remember as much as you can about the condition, its pathophysiology, clinical features, complications, treatment. So this particular condition looks like sarcoidosis, which is a type 4 hypersensitivity reaction. So these hypersensitivity reactions are mediated by T cells that provoke an inflammatory reaction against exogenous or endogenous antigens. Other cells, such as monocytes, eosinophils, and neutrophils, can also be involved. Some of the causes that we will come across are contact dermatitis, Stevens-Johnson syndrome and toxic epidermal necrolysis, tuberculosis, sarcoidosis, other systemic fungal infections, drug hypersensitivity. There are 3 main mechanisms of cell-mediated immunity, and these include type 1, which would be mostly macrophage mediated, type 2 or eosinophil mediated, and type A, type B, and then type C, which is cytotoxic. But they are all generated through T cell activation. And when you look at this, you can see how the reactions might vary. So, for example, the macrophage mediated T cell activated cellular immunity tends to lead to the aggregation of macrophages in tissues, causing granuloma formation and surrounding tissue destruction, whereas the eosinophilic mediated reactions can lead to other types of systemic response, and the cytotoxic type mechanism can be seen in some types of dermatitis and in other skin conditions such as SJS or TEN. It's important to understand that often with type 4 hypersensitivity, it's a delayed hypersensitivity reaction. It can take weeks or even months to develop, and there's often multi-organ involvement, including areas such as the skin, lungs, kidneys, joints, bones, and soft tissues, either through granuloma formation or through the secondary inflammatory process caused by the activated T cells. It's really marked by chronic inflammation, fibrosis, and scarring. So, for example, with things like sarcoidosis, systemic fungal infections, and tuberculosis, there's often pulmonary fibrosis and scarring, or severe cytotoxic injury, which is well characterized in Stevens-Johnson syndrome or toxic epidermal necrolysis. So if you have any questions about type 4 hypersensitivity, you can bring them up in class. If not, I would still urge you to read more about this topic and see if you can pick out some of the more common and the more important type 4 sensitivity reactions that you'll come across, like the blistering skin disorders, that is to say Stevens-Johnson syndrome or toxic epidermal necrolysis, or tuberculosis or sarcoidosis, for example. Okay, so this was the last of our 4 talks on hypersensitivity. Each of these talks were deliberately short and at an introductory level to give you a framework to work with as you go on to study these conditions in more detail. Thank you very much for listening. I hope you thought this series useful. Bye.